Advanced Primary Care Management. This is otherwise known as APCM. And if you joined our webinar last year, that we announced APCM when it came out for 2025. And basically, it's an enhanced care management model. We like to think that it's a value-based care version of CCM. And really what it allows to do is you manage those patients who are chronic, who need the help, but it's not time-based. You don't have to spend a certain number of minutes, and it allows you to identify and address gaps in care. So these are some of the objectives of what the program hopes to do. I'm not going to read them all, but this is still the same. It hasn't really changed from last year. And there's three rates. So I updated this chart with the rates for 2026, and it has gone up a little bit. I think the first tier was about $10 last year. Now it's $16.37. Level two, this is two or more chronic conditions, about $53. And then two or more and a QMB, this is now 117. So APCM continues to go a little bit higher. And I think that's a good news for any program in its second year. We like to see that they get better and better over time. The big change, though, Kathryn, is there are now some new BHI components for APCM, and we're big fans of behavioral health here at ThoroughCare. We have a lot of modules for it, but this is kind of an extra incentive to get some additional payment if your APCM patients need behavioral health services.
Definitely. And with this, I really love that CMS has done this. It's really acknowledging that behavioral health, like most clinicians know, that's inseparable from chronic disease management. We can't consider them two separate things. Often those APCM patients, they're still struggling with adherence, the motivation, and that can be from depression or anxiety. And having those issues really directly impacts the outcomes. So having new add-on codes really allows practices to bring the psych behavioral health expertise into APCM without needing to stand up an entirely separate program. Not every patient needs a full COCM, but many need ongoing behavioral health support. So clinically, it's really enabling the care team to have more holistic care plans, better documentation around behavioral barriers, because that's important. And that is just stronger continuity of care.
And those reimbursements are pretty good too. Look at that, 145, 133, 57.45. Even the general BHI add-on is significant. So I'm excited about this one. I think if you add a BHI or a behavioral health to any program, the patient gets a lot more value out of it.